So when I say health professionals, I'm not just talking about general practitioners and GPs in the UK. I'm talking about health visitors, community matrons, specialist nurses and consultants. So I just wonder, when I mention community matrons and health visitors, do you understand those roles in the UK? Does anybody need an explanation?
Not really.
No. Okay. So I'll just do a couple then. A community matron in the UK is a senior nurse who's highly experienced, and her role is to go out in the communities to patients and most likely to treat patients and care for them, give them a diagnosis like a GP and a doctor in their homes or at local, health centres, but more like in the patients' homes. Health visitors, they work with families of children from birth to 5 years. So health visitors support the development, health and well-being of that child until they start full-time school at 5 years of age. And specialist nurses, similar to consultants but not as higher in the healthcare structure or as highly experienced or knowledgeable, but a qualified nurse that will want to nurse in a specific field. So that could be cancer, asthma, heart disease, diabetes. So basically what we do, we constantly try and do in our organisation, is we're selling the awareness about our organisation and the benefits that health professionals can get to having that connection to self-help groups for their patients. So as an example, I don't know if you were in the UK, that our National Health Service, and this is a fact, it's at crisis point, it's at breaking point, and basically again by the fact that it's underfunded, there's not enough nurses, there's not enough doctors, and there's too many managers and too much administration. So that's why it's at breaking point. And the point of when we're trying to sell the benefits of self-help groups, that a lot of self-help group members say to us that when they go to a GP and they get a diagnosis, they get the diagnosis but they don't get... Sorry. GP, general practice, yeah, GP. So when they go, they'll be diagnosed and they may get a referral, but they don't get as much understanding of their condition, their diabetes, what is a healthy diet, what does that mean, what does their medication mean. When they do get that information, it's more likely that they've got it if they've gone to a self-help group. That's where they get that additional support from that, for that information. So the other problem that we've got in the UK is that people that don't understand their condition keep going back to their GPs for appointments they don't need, or they end up at crisis point with their long-term health condition, and then they end up walking into A&E, which is our accident and emergency departments in hospitals, putting a strain on that. So it's really important when we raise awareness that we say to health professionals that at diagnosis, the more information that patient or your client or service user has on their long-term health condition, they less likely are to keep going back to the GP, keep going into A&E, which puts a less strain on our NHS in the UK. And so the impact on that is all about how self-help groups come into self-care in the UK, because self-care, as Michelle mentioned, is a big thing in the UK that the government are focusing on at the minute. So the other point is that we work in partnership with health professionals to support service design, and I'm not just saying this because I work with Velma, but Velma's project is a very good example of best practice. So that's something else. When I say best practice, you understand that? Yes? Okay. So in terms of Velma's project, Velma was approached by the Clinical Commissioning Group in Nottingham City, which holds the funding and commissions services for health. And so Velma was approached to bring together people with diabetes in workshops in the BAME communities so that the commissioners could get more of an understanding of what people want with diabetes, what would make them go to those services, what works at the minute, what doesn't, and what is missing. So the impact on that is that through working with self-help groups and the groups that we work with, is that health professionals have access to group members to support that design of delivery. And again, it's the point of if people are active from the groups, and they get an active involvement in service design and delivery, they are more likely to access those services, which again is a less impact on the NHS and GPs and necessary appointments. We also provide training to health professionals. Again, that's all about who we are, what are self-help groups, how do they work, what are the benefits. And what we do when we train, we've got their co-delivery members of groups. Because there's a bigger impact. If you've got a room full of health professionals, if I tell you about a particular member of, his name's Terry, he's a diabetic, and he's just a wonderful guy, and he's always got a story to tell. But if Terry's in the room and tells his story of his diagnosis and living with diabetes, the impact is far greater than me telling Terry's story. So when we deliver training to health professionals, to get the message across of just how groups, good self-help groups are, we make sure that we've got members of groups that are present. It's all about that impact and positive selling of the self-help groups. Another important point, and I don't think it's the same in other countries, but in the UK, the one main thing about self-help groups, whether we've helped set them up or they're already established, is that at some point, if a professional has started a group, helped started a group, or is working with a group, that is short term, because there is some point where that self-help group is run by members for members, so it won't always be professionally led. So it's different in the UK that you get to the point that it's just members in that group. And sometimes we meet health professionals that are already, working with groups, running the groups, making sure the groups meet. But again, it's about capacity. So we support the health professional and the members of the groups to work through what we call a transitioning period. It's that moving on, so that both sides get, this transition. I'm trying to explain.
So the transition. They move from a professional led group.
Yes, but in that
peer to
that peer, just.
Yeah,
but in a way where there's not any problem, where there's a gap. That's it. Where there's not any gap, where the health professional hasn't been there in that transitioning period, where there's fear that the group may close. So we're sort of that middle ground that supports the professional to leave the group, and for members to feel comfortable when that health professional's not there anymore, that they can run the group and it can stay sustainable. So that's how we work locally. And we're trying to, what we want to happen in the UK is we want other areas to have what we've got, like a self-help organisation, the work that we do, because there's only us. It's not happening anywhere else in the country at all. So we do that locally, but when we work out further in the UK, our work then turns into being commissioned. Is everyone familiar with commissioning? So basically we get paid to go into other areas to deliver a piece of work. And just as an example, we refer to mapping. And there's a community in London called Wandsworth, and they approached us because they were interested in self-help groups. They sort of got the concept of it, but they just didn't have a clue where to start in their areas. How do you find out where groups are? How do you know how many groups are? So initially what we do is that what we do, map it. I don't know if did you put a map up with the pins? Was it you? Yes. So it's similar to that. So we go out and research that area and gather all the information of what groups are out there, and we present it in that form as well as a written report. But the point is about that as well, that where do you start? For that area, where do they start to gather information? So you need to look at, for us, we think about, okay, so where are groups more likely to meet? Where would they be? Where would we find that information? So local hospitals, churches, community centres, local health centres, GP surgeries. So we're looking at all those initially, and it's other things that we do in that kind of commission. It's as simple as just getting on Google and typing in self-help groups Wandsworth, and then now, because of the nature of online and information on the internet, you get reams of information that you can start off as well. So that's just a brief overview of a small bit of work that we can be commissioned, to broaden in the UK. But our aim is to make sure that there's more organisations like us across the UK and the work that we're doing. We also try and educate professionals, because what we get a lot in the United Kingdom, that health professionals have never got enough time, GPs have never got enough time to work with self-help groups. So instead of bombarding them with what we'd expect, we sort of give you an example of these are some of the roles of what professionals do already in the groups that we work with. So low-level support, that we call it, is a doctor may agree to display the group's posters in their GP surgery. So that's low-level support. High-level support is where a health professional may say that in their hospital or in their GP surgery that they have a room that they don't use. So you're welcome to have the room and you can have it for free. GPs and consultants then may quite happily go to that group and do kind of a question and answer session. Especially if it's a consultant and you've got people in the room with diabetes, then that consultant will get quite a lot of questions about that condition because of their education. And then from this, just to point onto this and onto that, a couple of years ago, and this is STEAM research, this was between ourselves, Anglia Ruskin University and Nottingham University in the UK, and it was to do research and then produce a guide for professionals working with self-help groups. And the reason I've just picked on this, is that connected to the internet? If you click on it, would it click? Yeah, we'll try. Oh, that's great, thank you, that's our website, thank you. So if you go onto our website and click on research, this is where this particular piece of research is. And the reason I brought it into it is that on page 8 of the research, it says what roles professionals can play, and it's a bit more specific. Is it that one, so I don't remove my PowerPoint? Just click on that one too. Yes. Just come out, is it?
Yes, yes.
Yes, thank you. Technology, thank you. So, in terms of effective roles that professionals can play, these ones particularly here, resource builder, capacity builder, etc. They're in the research because what's been acknowledged is what do these roles mean? So some health professionals will read these and think, yes, I do that, I'm the resource builder. Where other health professionals, this is good for them because they'll read through each and they think, I could do that, I could be the bridge builder, I could share information about this group to my colleagues and other health professionals. So professionals have found that really useful. So if you wanted to go on our website and have a look, that's really interesting. And the other thing that I'll just mention briefly about, I know Michelle touched on this about our directive, but it is classed really as, it's like a Bible to health professionals in the UK, and we've never got enough to give out. There's usually more demand. And because of the information in it, GPs will keep this in their room when they're meeting the patients. Community matrons will take this out with them, and health visitors and other health professionals. So say if a community matron was with a patient that had got, because community cremations work with patients that have complex needs as well, so heart disease, that they could look through this and think, yes, it might be good if I signpost them to a self-help group. And so this is a real biggie in the UK. We only usually provide it local, don't we? We only provide it local, but we do get people that are asking for it outside of Nottingham City and Nottingham. Are you after it? Are you taking it away?
It's no time for the Bible.
I think we have one. What kind of groups?
Okay. So finally, just another thing about our groups in our self-help groups in the UK. When we say they're autonomous, it means that they're independent. They're not regulated. They are really informal groups. So unlike charities in the UK that have to report back every year with their finances and their progress, they're totally independent. And this can cause a barrier sometimes for us when we're working with health professionals, because health professionals usually are in control and they work with organisations that are regulated. So we come along with these self-help groups that are not regulated, nobody's checking up on them or anything, and they can put the brick wall up, or they can get a bit twitchy. So we have to explain more about that, about the benefits, and that's why self-help groups work, because they're informal and it's just about those people coming together because they've got something in common. The other thing that we don't use in the UK as well, that health professionals never refer to a self-help group and they don't recommend. It's all about signposting. All you're doing is sharing that information to your patient, your client, your service user. and it's that signposting support, and it's up to that individual if they make a choice to go. Because in the UK, a referral, if a GP referred their patient on, it would mean that they would get information back from that referral. There's no showing of information to the GP or the health professional if somebody makes that choice to go to those self-help groups. So the point about our work with health professionals is that we work with them closely, we explain what we do, we explain the benefits, the positive benefits and the impact that self-help groups make on self-care in the UK at the minute, and also the positive impacts it will make if it's recognised more on the NHS system that is in crisis. So it's all about us passing that message so health professionals feel confident to signpost successfully their patients to self-help groups. And on the final slide, these are actually people that we work with. That's one of our GPs, Anna, that has been really supportive to Velma. But these are people that we work with that are in self-help groups, and again, the fact that it just works and it really is so positive in the UK, or we wouldn't have been going for 33 years. And the final thing is that we do a lot of productions of publications in the UK as well. So booklets for professionals. So if we're out at events to meet professionals, because we've constantly got to do that. We've constantly got to be out where the professionals are, trying to get in the GP surgeries, trying to get into patient participation groups any way we can. And at the events, little booklets that we pass on to tell about health professionals about us and all what we do and that support. Thank you. People don't usually give it back. They usually disappear.
So how I remember in the UK, actually it's only the Self-Help Connect UK is the only clearinghouse or existing. And your aim is not that in the other part of England, Britain, there are more clearinghouses. It's more educating the health profession to do this job, what in other countries the professional in clearinghouses do?
I think there's two parts of that, Carmen, because there is no other organisation or a clearinghouse, whatever. So part of our work is to see if an organisation in an area would take that on and do what we're doing. But then the other is separate, the health professionals, about how the self-help groups benefit. So we're not asking them to set up a clearinghouse. That's about us getting the message across that if you signpost your patients to self-help groups, it's about the impact on the NHS and GPs to reduce that impact. So there are two pieces of work there.
One comment and one question. The comment is on the signposting term. I love that. And actually, our local booklet, the directory of Gießen self-help groups, it's called Signpost. Right? Okay. So we use the German word for it.
Yes.
Actually, I think it's a very good example, this wording. It's a very good example of what we have to do when we, as an intermediate structure, not the groups, we discuss on self-help groups with professionals to have these tiny little differentiations in terminology. We cannot do that here because of lack of wording. We don't. We are happy if the word referral comes to our mind, right? So here it's not the topic, but at home it is very important to find the right wordings and to help them to understand what the connotation of this word is. So, dear doctor, here in this case, do something which is a little bit similar to referral, what you are used to, but please understand it's a little bit different. That's something new that you have to learn. So it's a very good example for the importance of wording. That was the comment. Now the question is, I am a friend of Self-Help Nottingham for, I don't know, 30 or more years. You know, I observed your work over all the generations, and one question I never found an answer is, why are you still the only one? There were times, as a little historic addition to that, there were times when we had a government-funded program of demonstration projects, model projects, whatever you call it in English. It was called the Self-Help Alliance. So in a certain time in history, there was money, there was some investment, there was research done by the Tavistock team, maybe you know that. Of course, like all these reports, it was positive, but it was the end to everything. For a short period, there was a national clearinghouse in London, perhaps for 2 years or something. The colleague working there was in our conference here, but only once or twice, then it was closed. Why didn't it happen that people from Liverpool and Manchester and Edinburgh and so on came to Nottingham and brought this idea back to their cities?
It's about funding, isn't it? Yeah. Sorry if I just... Yeah, I think it is about funding initially, because we are so unique from when we were set up by Judy Wolfe, you know, that original idea. It is really unique that we do that, because if you think of our local voluntary sector organisations, they will work with community groups, social enterprises and charities. But we are so specific to self-help, and it's so unique. I think it's, again, whether it's for want of trying to get the positive message across, but initially part of it is the funding. And over the years, and especially, I don't know if you're aware that we've just had local elections, so the government that is back in power again, the same, the Conservative government, how they work, we've had cuts through that, haven't we, politically. So the cuts that have happened are through the voluntary sector that we work in. So we know now that, you know, for our work as well, that it's highly unlikely that the funding would come through directly through the government. That's correct on that, isn't it? So you're asking another area to either have an organisation where they've got reserves funding to commission us, or to set up a, you know, clearinghouse or an organisation like us. But I think the impact on it is who runs the country, the government, and the funding, because the cuts go straight into the voluntary sector. So those most in need and the most vulnerable are the ones that are the people in the groups, and there's just not the funding out there, Jürgen. So I suppose that initially, I don't know if you've got to take anything to say on
that. Essentially, it's a way of the structures of local councils and how funding is allocated. So without going into too much detail, but it's essentially a structural kind of issue to where why something wouldn't be initiated in particular areas. And how the funding streams work. So of course anybody could take that initiative and apply to their local council, let's say, for funding, but that just hasn't happened. So what you have is lots of self-help groups all around the country just sorting themselves out, where what we are trying to do is gather that information together, so at least even if there isn't a clearinghouse as such, that information is better collated. But it's essentially a structural reason why there aren't, and the philosophy of the government hasn't been that that is an initiative. Now we're going to see a big sea change, as I was saying earlier, in regards to self-care, self-management, self-help. They'll group that all together, and absolutely where they have research that is saving the NHS money, they will be funding that. So I think we'll see more, you know, to come.
There's the other point where I mentioned about Velma's project as best practice, the clinical commissioning group, that because they'd approached Velma and Velma got people engaged to give that feedback about what works and what doesn't. The commission have actually seen firsthand that, you know, this works, self-help groups work, so they're actually putting it into the plan. So when they have their structure of, you know, how the diabetes services work and what will be out there, self-help groups will be in that plan. But that takes time, Jürgen. I mean, for that to even happen, you know, it's for Velma's project to be designed, developed and delivered. But how many years it's took before, you know, commissioners have said, oh, we get it now, we'll include it. We'll include it in that written, you know, commissioning document for services to be delivered. It's taken a long time.
One last question, because
Sorry,
the way we do it, we won't hear the break.
Yes, maybe I just didn't understand it during the presentation. I have two questions. One question is, are there any criteria to fulfill for the criteria for the self-help group to fulfill the figure in this booklet? And because you said there are rather informal and unregulated groups, if I understood you right. And the second question is, are these informations about the self-help groups also available online?
Yes.
Yeah.
So, yes, there is one criteria for the directory for obvious reasons, that if we publish this and then something changes or it's different, it means basically that the directory is out of date. So what we say that if a group has been running for 12 months or more, and because we work directly with the group, so as a worker I would know that that group is sustainable, it is established, and it's running, you know, it's comfortable, and it's running, it's got members, then they would go in the directory. If there were any issues at that time, I was working with a group that I thought, it might not carry on, there's too many problems, or we need a bit more time, we might need to close the group to members while we work on the issues, then it wouldn't go in that directory at that point. So groups have to be established to go in there, just for the fact that if we put a group in and then there were problems and it closed, basically we'd be getting calls about groups in the directory that are just not meeting anymore. And the difference on the website is that the name of the group is on our website and a description of the group, but not the contact details or the email addresses that you get in the directory. And again, that's not from us, that's the choice of the groups. Groups have to give us permission to, put them in the directory, put them on the website, give their details out, because we also have an information line as well, Monday to Friday, where people phone up for groups, to get the information. But what we put out, we have had to have permission to do that from the group, so it is online, but not as much information as what's in the directory.